Doctors of Reddit, what's the craziest case you've seen of someone faking it? Lady was in a minor rear-end collision and claimed that she was unable to see ever since the accident. Not just claiming that her vision was blurry. She was claiming no light perception. Safe to say we were a little suspicious based on the mechanism and initial imaging. Called neuro-ophthalmology in to prove she was full of it. You can't just say patient full of shit in a medical record unless they are there for constipation. But Ophtho was able to write a beautiful note that said just that, without directly saying it. Saw a guy fake a stroke convincingly enough that he got a very powerful clot-busting medication to try and reverse the effects of the stroke. His story only fell apart when he got a little cocky and started describing some visual symptoms that weren't consistent with his other symptoms. Repeat imaging revealed his secret. I thought the neurologist was gonna murder that guy. Instead we just discharged him back to jail. Obligatory, not a doctor. But my favorite story from one of these threads said that this lady came in looking for painkillers, saying she was having seizures. The doctor essentially said you're fine. You're not having any seizures. Go home. This lady flops on the ground and starts writhing around, pretending to have a seizure, before she eventually stops, going unconscious. The doctor says to the nurse in the room, she's not actually having a seizure. If she were, she would have lost control of her bladder. Right on cue. This lady pisses herself. Ugh. I'm in so much pain. But boy does that ibuprofen make my stomach upset. Do you have anything else you could give me that's different? Ma'am. I'm a physical therapist. I can't prescribe medications. This conversation took place while she was nearly nodding off and slurring during therapy. Obviously from opiates. Lots of faking takes place to try to score more drugs. We had a young guy come in with severe lower leg pain and a red area the size of your palm over his shin. We start treatment for cellulitis as his story sounds like that. But over the course of 4 days it doesn't get better or worse. Despite very normal blood tests and no fevers. On the 4th day one of the nurses hears a banging noise coming from the toilets. And sees a patient walk out with a metal water bottle. We confront him and he confesses to hitting his leg repeatedly so he could get time off work and pain meds. We discharged him on the spot and gave him a very stern talking to about wasting resources and lying and drug seeking. Not a doctor but a buddy of mine had a crazy ex. When he ended it with her she said she was pregnant. Knowing she was a little crazy he wasn't buying it. She sent him a positive pregnancy test. Just out of curiosity we googled positive pregnancy tests and clicked images. It was like the 3rd image. So knowing she was full of shit he just stopped responding, but that didn't settle well with her. The next day she went on to send him a very gory, disgusting tale of her having a miscarriage. She was basically describing a horrific, ER-worthy medical debacle that somehow she was dealing with all on her own in her room and still having the wherewithal to type out every single detail. The last text just simply said, I think it's dead. Don't know about any baby but the relationship most definitely was. I was a paramedic and picked up a so-called unconscious patient. He passed the sternal rub and the nipple twist test, and when I tried the hand drop to the face test his hand hit ground above his head. I told his family that something wasn't right because when I dropped his hand an unconscious patient would hold their hand up in the air. I repeated the test and sure enough he held his hand in the air. Because of local policy I did have to transport him to the local emergency room. Just before we went into the back of the emergency room with him lying flat on the litter I told my partner, hey, let's check on one more time and make sure he's still unconscious. I took his hand and extended it straight up into the air and shaped a bird with his fingers. We walked to the back with his arm straight in the air flipping a bird at the entire emergency department. When I came out of the room a trauma physician asked me what the hell was going on. I told him I was shocked that he didn't recognize an unconscious patient when he saw one. He laughed and told me to get the hell out of his emergency room. I'm a new medical coordinator at my job. When one of our residents, teen girls and boys, has an injury and the nurse isn't there I have to check them out. A lot of the kids fake for attention. Girl claimed she broke her ankle and was crying and ow 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 it hurts. Was told she had walked back from the gym fine. I just severely sprained my ankle 4 weeks ago, so I told her all I can do is give her ibuprofen. An ice pack. And she needs to rest it and keep it up. Not 30 minutes later she's walking fine and says the ice pack made it better. I've had to learn not to give them too much attention or they just keep injuring themselves. We had a lady come in hysterical after a car accident. At first, we were convinced she had a complete spinal cord injury at the mid-thoracic level. We checked her reflexes, rectal tone, pinprick in the feet, etc. We got a CT scan. Normal. We had no explanation as to why she seemed to be paralyzed from the chest down. Then she sat right up and vomited. And then immediately went limp again. We admitted her. Within a day she had fully recovered. I believe she was subconsciously terrified of being paralyzed and so her mind invented it. I don't believe she was intentionally faking it. After a while, it just faded away and she was normal again. One of the weirdest things I've ever witnessed firsthand. Not a doctor, but had classes with a girl who faked seizures for attention. Ranging from rolling her eyes back and falling over to full on flop like a fish. Definitely aren't any Oscars in her future. Obligatory not a doctor. I stubbed my toe on a banister when I was maybe 9-10 years old. After hobbling around for a week complaining literally all the time while my mum thought I was faking. My dad finally gave in and took me to the hospital. Turns out I pushed all the bones in my foot backwards and was on crutches for 2 months. Take that, mum. Not a doctor, but this girl in my school lied about having cancer. Ducking cancer. She would wear a scarf to school BC of the treatment for her cancer and even got called out for lying. Everyone knew but she still kept up with the lies. She was batshit crazy. My brother faked having cancer. Kidney problems. Having a kidney removed and being on dialysis for almost 3 years. Just found out recently it was all a lie. I felt like a faker back in March. I had an abscess on my jaw that I had gone to an urgent care for and gotten 2 fairly strong antibiotics. 2 days later I got in bed after no change in the abscess and started shivering violently like I had a fever, so I had my wife take me to the ER thinking the infection was maybe spreading. I told the nurse what was up and they took my temperature, which ended up being completely normal. The nurse's mood changed and I had a feeling that she thought I was in there looking for pills. They took me to a room and luckily the DR recognized my symptoms as an allergic reaction to Bactrim, one of the antibiotics I was on. He drained the abscess and prescribed me a milder antibiotic and some Vicodin for my troubles. I told my mom what had happened the next day and she then informed me that I've been allergic to Bactrim since I was young. For some reason it wasn't in my records. I hurt my wrist playing football. No swelling and I could move it, but I knew something was wrong. Went to the hospital. They wouldn't even give me paracetamol. Doctor clearly thought I was faking, exaggerating, but did an x-ray which he said was fine. It's just a sprain and to keep it moving. 10 days after leaving the hospital, they phoned me to say they'd reviewed my x-ray and I actually had a few small breaks in my wrist and I needed to go back immediately to get a cast. Not a doctor, but a dentist. Had a patient think I would prescribe her Oxy for really sensitive teeth. She even pretended to spit out the water in the dental cup and said she was in so much pain and couldn't drink or eat. I gave her advice on sensitivity and treatment alternatives. But she got angry when I said I don't believe her, not the sensitivity part, but the part she needed strong painkillers to get through the day. I finally told her I might not be qualified enough to diagnose her issue. So I'll happily write a referral to an expensive neural pain management specialist. She quickly declined and was on her way. Eye doc. When training we had a guy doctor shopping for opiates. Said he got bleach in his eyes and he did. But he put it in here himself. The tip off is always when they ask for a drug by name. Last time this happened, Valium worked really well, he did not get opiates from me. But who knows where he ended up. A guy I know got into a car accident and ended up being transported in an ambulance. Nothing broken. Just a small bruise on his thigh. He walked into the ER. He had his mom take pictures of him at the hospital holding his leg and immediately posted it on Facebook, thanking people concerned about him. He took off work for weeks. He posted on Facebook about his leg pain and about the car accident for the next several weeks even though people saw him walking normally. Med student here. Saw this one woman in A&E who self-presented. She was placed on a bed in a bay and claimed she had been hit by a car and was in loads of pain and needed morphine. Except she had no injuries. This lady is well known to come in once a month with various issues and every time she asks for morphine. When the doctor said they could only prescribe her paracetamol or NSAIDs, the lady lost it. She spent the next 3 hours either screaming her head off or loudly fake sobbing, saying she was in pain and needed morphine. That she was going to report us all to the GMC. That she was going to write to her MP. We told her that she needed to vacate her bed because she'd been discharged. Well, she wasn't very happy with that and screamed saying that we were cruel people. That she was paralyzed from the neck down and couldn't walk. One of the junior doctors made the mistake of saying that we'd all seen her walk into A&E. And that started her off again. She claimed that we were all liars. That the security cameras had been tampered with. And when security came to remove her she pissed and sheet herself. Moral of the story, don't work in A&E. Not a doctor, but a former health worker at an inpatient psych facility. Had a depressed patient whose real problem was a hardcore OxyContin addiction. He pushed himself around in a wheelchair for his supposed back problems and would literally nod out mid-sentence while begging for more OxyContin. Me. How bad is your pain in your feet? I'm a podiatrist. Patient. 11/10. I need something stronger than this morphine drip. This is while I'm palpating all over his feet and he's slurring his words and falling asleep. People become the best actors when they want narcotics. Anyone from 20-year-old college students to 95-year-old grandmas can become narcotic addicts. They're everywhere. ER nurse. There's always drug seekers everywhere. But it isn't always obvious who is and who's in real pain. Except for this one woman. She came in saying I have 10/10 pain and demanding opiates and Tridge. Given a room. Scanned. Nothing obvious in the workup. Sent home with non-opiate painkillers and told to follow up with PCP. 15 minutes after discharge comes back in wearing the same clothes and tries to check in with a different name with a new body part hurting. It was the same staff at Tridge. She did it for over a month at multiple hospitals within a 2-hour radius. Pretty sad to be that desperate for drugs. When I was an EMT we transported a patient to a hospital I didn't frequent in a zone I wasn't used to. A PA came in as we moved her unconscious self to the bed. He goes yes. XXXXX. Unconscious? We said yes. He picked her arm up and dropped it over her face. She moved her arm so she wouldn't hit herself. He then loudly called her name and said it's time to wake up. She acted like a kid getting up for school when they thought it was gonna be a snow day. Nothing wrong with her, physically, psychiatrically. Yay. A 16-year-old girl arrives at the hospital alone claiming an unbearable allergy. She had surface blisters all over her body. No exam pointed to any problem. Obviously we distrusted her and she accused her own mother of burning her body with cigarette butts. She cried. An actress. Police was called since the hospital reported child abuse. Only after much pressure she began to fall into contradiction until she was diagnosed with Munchausen syndrome. She was burning her own body to blame and punish her mother. Not a doc. But I have my own case of faking the shit out of a sickness when I was in 3rd grade. Woke up one day and got a case of duck this I don't wanna go to school. Started coughing. Like whooping cough bad. After a few weeks. Doctors told my parents they didn't know what the deal was. Kept faking it. Doctors were like it might be his adenoids got them removed. Stopped coughing. Missed a month of school. Didn't have to make up any assignments. Parents still don't know.